Well, I have to find it later. I can still halfway read. Okay. I know. I'll find it after we get off. It's somewhere. Okay, well, I hope you all had a good weekend. We're heading into a new week. Well, let me put on the recording. That won't be good. We forget to do that. Okay, so we're in week 4. So we are halfway through. I know weeks do need to slow down. They go so fast. We're already in week 4. Seems like we just got started not too long ago, but here we are halfway through. So with week 4, we are covering the respiratory and the cardiovascular, blood and lymphatic. That's where we are. So that will be chapter 20, chapter 21, and chapter 22 in your textbook. And tonight I'm going to mainly focus on the cardiovascular. That chapter has a lot of good things I want to cover out of that. So as far as the respiratory is nothing really just something out of the ordinary in the respiratory. But of course, that's dealing with your lungs, your nose, and so forth. Those organs dealing with your breathing and that kind of thing. Your larynx, and you have your general type procedures, nose, those things, like your incisions, excisions. You also have procedures with removing foreign bodies, repairs, and they go through each of those anatomical areas that make up the respiratory system. And I'm not going to spend a lot of time on that. Like your tracheostomies, they all fall under. They would be under the respiratory system. You also have lung transplants. You got several different organs that they transplant. So you have that. And actually, when we get to the cardiovascular, they also have codes in the cardiovascular where they would do both a heart and lung transplant, and they have codes doing both or just one. And so that's about it for the respiratory. I want to move on. Like I say, I'm going to focus mostly on cardiovascular tonight. And so let's do that. So if you have your coding manual, make sure you get that out, because as you noticed before, I like to oftentimes point to that in my discussion, some of the codes in there. And I'm going to try to situate these books. One thing about coding, you will walk around looking like a nerd because you have so many books. You got, you're carrying, especially at least you all have ebooks, but if you get your textbooks, hardbacks, and then you have your big old coding manuals, it just looks, some people look at you crazy, or especially if you go take your credential exams and you have to use your coding manuals. You'll have 3. You'll have your HIT211, you'll have your ICD-10 CM, your ICD-10 PCS, and your CPT book. It made it worse when they separated ICD-10 into 2 for the procedure and 1 for the diagnosis. They used to be in ICD-9. They were all in 1. So now you got 4 books, but it's kind of interesting. But anywho, with cardiovascular, now those with your cardiovascular coding and your CPT manual, you will notice that these codes begin with 3, right? So you can you'll recognize that. If you look in your coding manual in the cardiovascular system, it's pretty much divided into a couple of major sections. you have it's like two major subsections. So you have your heart and your pericardium, and then you have procedures on your arteries and veins. Okay, so those are the two subsections. Now, when you're coding in cardiovascular, you will, in the overall scheme of things, use three different sections out of your CPT manual. That being what we're studying now, which is under the surgery section, right? Uh, your cardiovascular system on your surgery section, which is pretty much your invasive type procedures, right? Invasive meaning, we're gonna cut open and go in to do whatever the particular procedure. So you got your invasive type procedures under your surgery, cardiovascular. Also, you have some cardiovascular coding that's in your medicine section. And you with your medicine section, those codes start with 9. And we haven't really covered those. I think they'll be covered in week 7, I do believe. But there are a couple of codes in the medicine section for your cardiovascular. They're mostly non-invasive type procedures. Um, and again, your medicine section codes begin with 9. Um, Now I know your E&M, they begin with 9, but they were all like 9 for your medicine section of codings. They begin with 9 and some other digits. You probably have maybe about 5-ish of codes that begin with 99, but those are exceptions. Most of the other codes begin with 91, 92, 93, so forth. Okay, but again, you do have some cardiovascular codes in your medicine section, and then you also will use radiology codes for your cardiovascular type procedures when they are using some type of radiologic guidance. Um, these codes begin with 7. Okay, we haven't really discussed the radiology chapter either yet in specifically, and that'll be coming up later on as well. So these, if you're looking at the slide here, our agenda, I'm going to pretty much look at 3 procedures in specifically, and those are your coding for your pacemakers and your cardioverter defibrillators. We're going to look at cabbages and vascular injection procedures, and we'll do one. We have one practice coding example, and then we're going to look at our week 4 cases. All right. So right here, I kind of really got ahead of myself. We've already talked about the overall format for your cardiovascular section of coding under your surgery section. Here is the range that it covers, your 33010 through 37799. Now, one thing I hadn't mentioned before is that, and you probably have noticed in just about every section, you will see what we call unlisted codes. Have you all noticed those? And I don't think you may have read about them in your textbook, but I don't think we really talked about them per se. And so what those codes are there for is when that particular, maybe you are looking up a particular procedure. However, you don't find that in that section, something that's appropriate for whatever you're trying to code for in your documentation. If that's not listed, if that service or procedure is not listed in your code book, then you can use one of your unlisted procedure codes for that section to indicate that particular service. But when you do that, and this should not happen very often at all, this will be far and few in between. But when unlisted procedures are used, then it requires that a special report be created to explain the details of the procedure that was performed, okay, and then alongside that unlisted code. And so that's what that is. And each of your specific guidance, the guidelines for each of your different sections, usually on one of the last couple of paragraphs, they'll talk about that what those unlisted procedure codes are and that special report that's needed. And I just thought I would mention that because I hadn't specifically talked about that before. But again, far few between should you be using that. Okay, so more than likely it should be a code available. All right, so moving on. Moving on from that, we're going to start with the pacemaker and the defibrillator. Okay, and in your coding manual, that begins with the first code. Let's see, I'm in my coding manual. Begins with 33202. What you'll notice if you flip to that 33202, I apologize if you hear a lot of wrestling. I got a coding manual and books and everything all over the place. But if you go there, talk about I'm going to talk about our pacemakers and our cardio defibrillators. Excuse me. All right, trying to move my manual. And the thing about in your coding manual, the illustrations are very good because if you flip through, you'll see a lot of notes on your pacemaker and your defibrillator. And if you flip, you got a nice table there for codes with the procedure and whether it's a pacemaker system or defibrillator. And then you flip again, you will see some good illustrations on what that pacemaker and defibrillator looks like. All right. And so basically, with your pacemaker, let's talk about that a little bit. Usually they use this pacemaker to help correct different abnormalities of the heart in terms of dysrhythmias. I'm pretty sure you probably heard of that, meaning an abnormal heartbeat, or maybe the rhythm is irregular in terms of its pacing, or the heart rate is too low or too high, right? And so that's what they use a pacemaker for. It corrects or manages those dysrhythmias. Now, when we look at the pacemaker itself, are basically the components of the pacemaker, then it entails you have what you call a pulse generator. All right, that's one of the major parts of a pacemaker. The pulse generator is another word for it's the source of power, where the power comes from for the pacemaker to work. Or other words, we call it a battery. Okay. You also have with your pacemaker what we call electrodes. These come out of the pacemaker and they insert them into the heart. Now, with your pacemaker, you could have multiple electrodes or leads from that pacemaker. Okay. So you have that pulse generator, you have your leads or your electrodes, right? And we talked about the pulse generator being the battery, right? The battery, it has, so you got the battery, the leads, and those leads insert into the heart, and it goes through a vein. or it can be placed on the surface of the heart. So if it's inserted, if the electrode is inserted via the vein, we call that like transvenous. Or if it's placed on the surface of the heart, that's epicardium. Okay, and then they can do a temporary pacemaker or a permanent pacemaker. Okay, and so with in terms of procedures of a pacemaker, insertions, so they can be inserting the pacemaker, they can be removing it, they can be repairing it, they can reinsert it, so maybe they take it out and reinsert it, replace it, reposition it. If you look and flip through your coding manual, you can see some of those represented in those codes. Okay. Now, when we're looking at a defibrillator, it pretty much does what a pacemaker does, except for it also addresses if a person has a heart condition which the heart may stop. Okay, so in the other, when we're talking about the pacemaker, they may have irregular or abnormal beats and rhythms and heart rate, but then you have some patients or individuals in which their heart stops. And so what the defibrillator does, it does all the other things that pacemakers do, but it also emits shocks. And so those shocks that it emits will stimulate that heart to begin beating again. Okay, so that's the major difference between a pacemaker and a defibrillator, right? So if a person is dealing with erratic electrical impulses or things like that, then the defibrillator would be what they would need versus a pacemaker. All right, but in terms of these different procedures, they are pretty much the same. Okay, with a pacemaker and defibrillator, you can insert it, remove it, so forth. Okay, so when we're going to look at correctly coding your pacemakers and your defibrillators, you have to pay attention to a couple of things. So you need to know where the electrodes are placed, right? Because we just talked about they can put them in different areas, right? So we need to know where they place those leads. Then you want to know whether this is an initial placement. Are they removing? What are they doing with the pacemaker or the defibrillator? Or what parts of it? Maybe they're not doing some of the entire thing. Maybe they're only doing something to a component of the pacemaker or part of it. And then we need to know what was the approach, right? Because we just talked about that as well. You know, was it transvenous or was it epicardial? All right, so you have to make sure you are able to identify the answers to all those questions so that you can properly code in this section. All right, that table I was showing you is a good deal as well. And so just to put that in a nutshell, what they do is when they are going to place a pacemaker. I'm sorry, it seems like I can't speak. They make like a little skin pocket in which they slide that pacemaker in. And if you're looking at those illustrations, um, you can kind of see that where they put that slide that pacemaker, that defibrillator. They make a little skin pocket right over the chest area for it. Now, also, when you're looking at these two devices, you want to pay attention to whether fluoroscopic guidance is being used in order to do that procedure for that pacemaker. Um, if it is, then you're going to probably need to add an additional code from the radiology section. And you remember at the beginning when we were talking about this, I said there were three sections of the CPT code that you may the CPT coding system that you may need to use, and one of them was radiology. So fluoroscopic guidance, if it's not included in your coding description, then you will need to append a code from radiology, which begins with 7, to whatever else other code you are using to identify the procedure for the pacemaker or the defibrillator. Okay, and I just want to remind you, if you looking at your documentation and it talks about changing the battery, then that means we're replacing the pulse generator. That means the same thing. Okay? Any questions on that? Do you understand how that works? Everybody got it? But you got some good pictures there. Yep, yep. You always go back and study. And a lot of this, I'm just talking about it. But you, after this, sometime this week, you go back, review it, and try to practice a couple. Come back and listen to it again, and it should be very helpful, especially when you get in there and really start working on these different chapters, problems, and things. Then some of the things I'm saying to you now will make sense. Yes, that workbook is there for you to practice, practice, practice. It's always easier when I'm talking, but when you get to doing it, it should make more sense. And if you have questions, you can always shoot them out to whoever your instructor is. Okay? All right, so that's pacemaker defibrillator. Let's move on. Oh, my example. So we're going to do, let's practice right now. Let's do one right now. And I'm going to read it, and then you're going to code it. And we remember when we're coding, we're going to go to the index, and we're going to look up our main key term. And that's how we code, right? We don't go to the tablet, although we may be in that section because we just got through talking about it, but our proper way is to go to the index using that key term. All right, so let me read the example. You all get your coding books and be ready to look up the code for this. So the procedure is replacement of pacemaker generator. It says the patient was brought to the operating room and was prepped and draped in the usual fashion. The patient was consciously sedated. The previous subcutaneous right infraclavicular skin pocket was identified, and an incision was made in this area to remove the previously inserted generator. The atrial and ventricular leads were checked. Since the pocket was clean, it was determined that the same pocket could be used for the reinsertion of a new generator. A pulse generator was placed and tested. Noting no complications, the physician sutured the site. The patient was found to be in stable condition and was returned to the recovery room in satisfactory condition. So looking at this problem, what would you look up in terms of a key term? Are you going to look up removal and replacement? You try it. All right, Shari said pulse generator. Okay, go try that. So we got two students looking it up different ways. Remember we talked about there are multiple ways you can find a code a lot of times. Somebody else got another suggestion? So hopefully you all are looking it up. See what you get. Okay, so Sharon has removal, pacemaker system, pulse generator. Okay, what code? You what do you think it is? And she has 33233. let's see. Okay, I had to look again. The eyes. Alright, let's look it up. Let's see what we have. Okay, I think I got mine is out of order. Let's see if I can find 332. Is that 33223? What do y'all have here? 33233. Yeah, because I that's not what I have. So I was trying to see what you all pulled up. So let me go to the back and see what you all follow, because I went a different way. Hold on. So she went removal. Let me go to the back. Let's see what we got. Removal. And actually, this is not a removal. That's not going to be correct. Removal is not correct, because what's our procedure? Even before I look, what do we do here? We did replacement. Oh, so I see what you're doing. Remove. Let's go to replacement. I see what you did. You did removal, and I get it. Because we're going to remove it. In order to replace it, we're going to remove it. Okay. Mark has 33203. How did you look that up? Did you go to replacement? Let's see what you got. What year book do you all have? Yeah, let's see, 33. Okay, I see 33203. Let's see what you have. Insertion of epicardial electrodes. No, not 33203. No. So replacement says C pacemaker replacement. Okay, then you follow that direction. All right, 2015, 215. I got 216. Sometimes you have to be careful because there are changes from book to book. But so Sharon says replacement says C pacemaker replacement. Martin, wouldn't be surgery cardiology, because when you read that code, it's an insertion of the leads, and that's not. We did a replacement of the pacemaker generator, which is the battery. Okay, Katrina has 33. Okay, so that's the range. 33227 through 33229 would be correct. But let's see. So Katrina says it's 33227. And that says removal of permanent pacemaker pulse generator. So that part is right. With replacement of pacemaker plus generator. So it has both. But then it says single lead system. Now, do we have a single lead? What is that? Is that, you remember we talked about you can have several leads. So 33227 is a single lead system. Is that the system we have? It's two leads. How do we know it's two leads? Yep, atrial and ventricular. Now, Mark, you had 33215, and let's see, repositioning of previously implanted. So that's not a reposition. Now, when you looking up your codes and you verify, so you're gonna look your codes up in your index, and then you verify in your tablet. When you're verifying, when it says, and you're reading, it says repositioning, and you go back to your documentation, and your procedure is not repositioning, it's a replacement. So repositioning means moving it or adjusting it, but this is not adjusting. We actually replaced it. Okay, you got that, Mark? And the 33228 is correct. So the 33227, you all, that's another thing you have to pay attention to, because after the semicolon, right? So when you got the 33227, you see that there are some indented codes under it. So you already know that after that semicolon, those words make a difference. So in 33227, it said single lead, right? But when you go back to your documentation to verify if that's appropriate, it talked about atrial and ventricular leads. So that means it's a dual, which means we need to go 33228, which is essentially the same thing as 33227, other than the number of leads. Right? Yep, that semicolon is a big deal. So did everybody catch that? And does everybody understand what you're actually doing? So when you look it up in the index and you come up with some codes and you go and verify in the tabular, you need to be checking to make sure it's describing whatever is in your code that you're verifying is describing what they're actually doing in your medical documentation. Now, a lot of times it's going to use the same or similar terms. Every now and then you will get something that sounds weird, but is actually describing the same thing. And what may have to happen, if you are unsure, you may need to get you some reference material to verify. Because no coder, I don't care how long they code, we heavily use reference material because you're just not a walking encyclopedia, but we do know how to look up stuff and check. Okay, so there's nothing wrong with that, and so you should do that. But most of the time, it should probably word for word, or close to it, where enough for you to see that's the same thing. Every now and then, that's not the case. Okay, very good. Moving right along, unless there were any other questions on that. Okay. Now, I'm going to talk about cabbage. Okay, so you need a pot and you need some salt, pepper. I'm just joking. Okay, we're going to talk about cabbage. Not in a cooking class. All right, let's move on to that. I've got to move my coding manual. Hold on. I need to get a bigger table, I believe. I don't have enough room, I don't think. All righty. Cabbage. So your cabbage stands for coronary artery bypass graft. We have to laugh. It's kind of late, so I have to make sure you're awake. Okay, so we got to laugh about something. So it stands for coronary artery bypass graft. And let's see what codes. Where we let me give you the code numbers. I'm all over. All right, so this is in 3. I think it starts at 33510. I think. Let me flip in my coding manual so we can eyeball it. 33. Let's flip over, see what it looks like. 33510. Right, I think that's the beginning of it. And it actually got some illustrations there for you as well, so it's good to look at that. 33510, and you see some coronary artery bypass pictures there. And so basically, with this, and we call it Cabbage, CABG. So that's the acronym. We pronounce it Cabbage. And basically, just to explain the procedure just a little bit, so you know what's going on. They use it to improve the flow of blood in the heart. So your vessels, the blood flows through the vessels. And when you have a situation in which those arteries, we call them vessels, those arteries are blocked, maybe got some plaque or something else in there that's blocking, and so the blood is not able to flow, then we can use the Cabbage procedure to assist in improving the blood flow. And the way that they do that, they will take or remove a blood vessel from another part of the body, say your arm, your leg, your chest, or something like that, and they're going to use that to bypass or detour around the area in the heart which is blocked, or the lumen of the, and lumen is nothing but an opening of that artery is blocked where the blood cannot flow. So they're going to use that other vessel, which we call a graft. That's where the graft part comes in, to bypass or go around it, to detour. Okay. Now, in order to code for a Cabbage, a lot of times you're going to look at your operative report, because you're going to be looking for a couple of things. And if you're in your coding manual, you'll see a couple of sections in which you're going to code for cabbages. So you have your venous grafting only for coronary artery bypass. I think that code starts at 33510. So venous grafting only for coronary artery bypass, meaning we're going to use a vein to do the bypass, right? So you got your section of coding for that. Then you have a section if they're going to use arteries and vein grafts in the Cabbage. And then you got one, just if you flip over, you have another section for arteries. Now what you'll notice about the combined artery and venous grafting is that they are add-on codes. Do you see that? Starting at 33517. You see that those are add-on codes. Does everybody see that in your coding manual? Okay, so you need to flip. If you go to 33510, that's your venous graft only. So you're using different vessels to do your bypass. If you look at your little pictures right under 33512, you'll see how in that picture there, that's a vessel, which is a vein that they remove. You see it from somewhere else, and then they're bypassing it. Right? You see in those pictures. Um, if you look in that B picture, they actually use 3 to bypass. Everybody see that? So, but with the combined, if they're going to use arteries and veins, what I was mentioning is that those are add-on codes, if you're looking at it, and which means that you're going to need 2 codes in order if they're going to use both. Okay. In the little notes right above 33517, they actually talk about you needing to use 2 codes. So it says 1, the appropriate combined arterial venous graft code 33517 through 33523, and then you need the appropriate arterial graft code, which comes from 33533 through 33536. So if you look at, like, say, 33517 with the add-on code, it says coronary artery bypass units using venous grafts and arterial grafts, single vein graft. Now, so we're going to use the add-on code, which means we cannot use that as the main code, right? So we're going to get the main code from the 33533. So if you flip over from those add-on codes to the arterial section that begins with 33533, and so you see the list of codes. So you're going to need that artery code, and then you're going to use the add-on code from the combined arterial venous grafting when you have both artery and veins for your Cabbage. Does that make sense? Yes, sequencing matters. That means then you're going to use the arterial first, then your add-on code. Your add-on code is not reported first. It's reported in addition to the other code. Now the other, everybody got that? So let me go back up because you all are typing so fast and my notes going up. Let's see what you're saying. So, no. So, if you got an artery and venous, you're going to use your arterial. See what your notes tell you. You're going to report two codes. Look at that second paragraph on the combined arterial venous grafting for coronary bypass. Skip the first paragraph. Go to the second paragraph. And it tells you the two sections. So you're going to use a code from this section, the add-on codes, as well as your code from your arterial graph, which is you flip over the next page and you see it starts with 33533. Do you see that? Now, if you're only using veins for your cabbage, then you have a section of codes for that beginning at 33510. Everybody see it? Okay. Now, the other thing I want to mention about this, so in your procedure, so when they're doing, coding ain't finna fall. All right, so when they're doing this procedure, and we talked about, tearing up my pages. Okay, so again, I'm sorry, I'm trying to flip my pages and books. When they're doing this procedure, we talked about them getting a grafting a vessel from some other area, your arm, your leg. They can get vessels from a cadaver to use to perform a cabbage. Okay. Now, so harvesting of the vein, right? If when they harvest the vein, depending on what type of vessel it is, it will determine whether it's included in that cabbage code or not. So, for example, usually with this type of procedure, they will use a saphenous vein. Okay? And if they're using a saphenous vein, which is the most common vein that they use, this is going to be included in your cabbage code. Okay? Now, if they harvest any vein other than the saphenous, then you can separately report the harvesting of that vein. And so they have codes um, for that. So if we look, let's see, look at code 35500. And I'm sorry, I don't have my glasses on, so I'm trying to see. 355, let's flip. 35500. Let's see if you can find that in your coding manual. All right, so you flip, go to flip to 35500. And then you got 35. You see it? Does everybody flip? You got it? So if you go to 35500, you see that is also add-on code, but this is for like harvesting of when this is other than a saphenous vein. You got the 3550, and then 355. Let's see what the other one. 35572. So 35500, harvest of upper extremity vein, one segment. 35572, another add-on code, harvest of a femoral papillito vein. So again, saphenous vein, if saphenous vein is used, you don't need an additional code. If they use a harvest a vein other than the saphenous, then you're going to have another code that you're going to report to indicate that the other vein other than saphenous. Okay, and that goes across either one, any type of these cabbages. Does that make sense? So that's important. Have I lost you? Have I got it? Oh, let me move down. Okay, so somebody said, what? Wait, I'm trying to read everybody's notes. So we will only use the venous only code if that was all. Yes. So if the cabbage only used a venous, if they only harvested a vein, then you would use the ones for the vein. All right. If they only harvested a artery, then you would use the artery code. But the only time you're going to use the two is if they use arteries and veins, then you're going to use the combination code and the artery code. Okay. Now let's see, what would a code look like if it was a combination? All right. So let me flip back. So this is a couple of things you need. So so if I got three, let's see. So maybe if I'm going to use, say I use 33534, where we're going to do the cabbage, and we're going to use two coronary arterial grafts, right? And then I'm going to have, and then depending on how many veins, so you're going to have to know how many. Then I can use, say if we're going to use two arterial grafts and two venous grafts, then my code would be the 33534 and then 33518. So basically, you got to know how whether they're using arteries or veins, right? In order to code here, you got to need to know whether they're using arteries and veins, how many of each, so that you can know because each, if you notice that you got one, got two, three, four, so you can choose. And if they're both, then you're going to use the combination plus the artery, or if it's just a vein. So you need to know that, and then you also need to know whether it's a saphenous or not. Because if it's saphenous, then you're going to it's going to be included. But if it's other than that, then you need additional coding for the harvest. Okay. Uh, Everybody good? Right. You're gonna get that information from the your documentation. It's gonna tell you what they harvested, and that's gonna dictate how you're gonna code it. Tell you how many. It's gonna tell you all of that. Okay. All righty. So we would still use that code, but the add-on code would say yes. If you're they're doing something other than the saphenous, then you're gonna use the other add-on codes we're looking at, because they could use, like they were talking about, the femoral papillito vein, but all of that will be in your documentation so that you know how to handle it. I just gave you all the things that you need to pay attention to when you're coding a cabbage. All right. Yeah. So that's what you need when. So if you got your thing and it says, all right, they're doing a cabbage, then you should automatically start thinking, all right, are they going to harvest arteries, or are they harvesting veins? Are they doing both? How many? Which one are they using? That's the stuff you need to start asking. And then when with these cabbages, in terms of modifiers, um, your HIT modifiers, they have some modifiers that you'll often see used with your bypass graft codes. They have like a LC for left circumflex coronary artery, LD left anterior descending coronary artery, RC right coronary artery. So sometimes you may see those appended on the code since we're dealing with the arteries and veins. You may see those, okay, indicating the particular artery or vein. Okay. All right. All right. We're gonna move on. That's the cabbage. Let's go to a section in the arteries and veins, which was that other large section. We were mostly in the heart, and now I want to look at a couple of things in your arteries and veins section. Procedures on arteries and veins, which is mostly what I'm going to talk about is um, your catheterization type procedures, and you'll mostly see these under like your injection type procedures under the vessels and arteries. And the reason one thing about your arteries and veins, if you all had your A&P, which I'm sure you had, to me, the section on arteries and veins were one of the more difficult because it's so many arteries and veins. To me, the bones, muscles were easier, but arteries and veins, it's just so many. Your textbook does have some good illustrations of arteries and veins for what we're going to talk about. But and also, if you look in Appendix L in your CPT manual, we can flip over there. You have your vascular families, which will be of help for the particular section we're getting ready to discuss. So you just flip over and look at Appendix L right quick. In your textbook on page 614, they kind of go through some arteries and veins and talking about what we're getting ready to talk about. But this is what an example of why it's good to know your way around your coding manual. Appendix L, you see your vascular families. It gives you the first order, second order, third order, and so forth. Because again, to me, your veins and artery section was a little bit challenging or difficult, I must say. So let's talk about um, the catheterization. So you got selective vascular catheterization, and you got non-selective vascular catheterization. So when we're coding for these, because um, a lot of times they will use this because they need access. They're trying to gain access to your vessels, your arteries and veins, um, and they want to do different types of procedures or to place some kind of substance in their gases or whatever it is that their desire. They will use the catheterization in order to access that and to do that, right? Um, you got your venous access devices that they use to gain access for fluid and medication delivery, which is you call CVA. You got your central venous access. Again, trying to access that and putting something in there, or trying to perform some type of procedure. Now, but when we are dealing with these, and they fall under a lot of them fall under your injection section, it could be kind of difficult because we are dealing with all the vascular families, and it could be anywhere within there. And so you got to have a knowledge of the flow of blood and how it goes through that circulatory system. So I would suggest using that Appendix L, even maybe getting you some kind of anatomy and physiology reference to assist you in coding procedures for catheter placement. Now, your selective vascular catheterization procedures will be classified as your vascular injection procedures. Um, They could be diagnostic, therapeutic. Again, vascular access is what we are looking at. Um, you don't report separate codes, say for if they're going to administer the anesthesia, if they're going to introduce that needle or catheter or injection of contrast material. You're not going to report separately when you're going to append these codes. However, the contrast that maybe they're using or that they are injecting into, you will see them use HIT211 codes a lot of times for the specific contrast material that's being used. Now, so the CPT coding for the access, right? You got CPT codes that it's gonna assign the point in which the catheter is placed. So when they put in the catheter, a lot of times they may have a guide wire that they insert into there. They could insert other kind of surgical instruments through that catheter. So that catheter is sort of like a conduit for them to administer different equipment or surgical instruments or some kind of fluid or something of that nature. All right, and so the CPT code is going to assign to the point in which the catheter is placed, and we're not going to, and not how the guide wire is being inserted. And the guide wire is what helps them to navigate. Okay, so let me talk a little bit more about the selective vascular catheterization. When it's the selective versus the non-selective, that means they're going to puncture at some point, right, in that circulatory or that arterial system, and they're going to puncture and insert and manipulate that catheter, which has the guide wire attached, into the different branches of the arterial system. All right. Again, they're going to use that to guide them to wherever they're trying to get within that system in order to perform whatever procedure that they're trying to carry out. And they're usually going to use some kind of fluoroscopic guidance in order to help them to navigate through the arterial system. Now, the way we're going to code this is you will code where they are ending up. Okay? So the code, they'll go through all your different, so they may manipulate it through your first order vessels, second order vessels, or wherever they're going to go through until they get to that intended vessel that they're trying to perform the procedure. All the vessels that they are not going to code for, that they go through to get to where again, they're called non-selective. Okay? So selective is the end point. So we're going to talk about the end point. All the ones that, and that's where we're going to code. That's the code that's going to be assigned based on the end point where that catheter guide wire stuff ends up, and all the other orders of vessels that it goes through is non-selective. Okay. We do not report the non-selective areas. So it advances past where they puncture the vessel, they introduce the catheter, and then they manipulate and move it through the different orders. Because if you look back at Appendix L, that's where we're talking about first order, second order, third order, and so forth. So once the catheter gets to that intended vessel, that's where we're going to assign the appropriate code for your selective vascular catheterization. Now, they may navigate to that particular point. Then maybe they also, within a procedure, need to go to additional vessels. So maybe they puncture in another area and navigate um, through those to another point in which they want to take care of. Okay? So when they have additional vessels that they catheterize for a procedure, then you're going to assign codes for that selective vascular catheterization for those second and third order vessels, right? Again, Appendix L will help you in terms of vascular family. So if you are reading through that particular section, you will be able to identify where you are, right? Because it will talk in terms of first order, second order, and third order. So if it's a first order vessel, then that means it extends off of the primary branch from the aorta. So your aorta is usually that the main little highway. So if you can think about it like a tree or like a series of highways, right? And if you look at the vessels, say you look at the ones on in your textbook on page 614 or in the somewhere, find a picture of your different arteries and veins, and you know it splits off, right? You'll be going up, and then it turns into a little Y, and you split off, right? Everybody is familiar with what that looks like. So if you're on that main vessel, maybe you want to call that, since we're talking about first order, second order, you can call that main vessel 0.0, right? And then if you have a vessel that shoots off from the main, that's going to be your first order. Does that make sense? And then off of your first order, if you have veins that shoot off the first order, that's going to be second order. And then if you have, they usually get smaller and smaller, right? And if shoot off the second order, it's the third. And any that shoots off the third order would be the fourth. Everybody get that, what I'm saying? So when you're reading in the documentation and it's saying, for example, brachiocephalic artery first order, right? That means that brachiocephalic artery that we're talking about branches from the aorta, right? And then say after that, if you're looking at your appendix L, then second order, you got the right common carotid artery that shoots off from the brachiocephalic artery. That will be second order. It's like a tree, family tree, exactly. And so that's what you need to understand when you are coding for catheterizations in this manner. All right. So you got first order, second order, third order, so forth. So it might read something, because I got like for example, I'm gonna read something that you may see in your documentation. All right, so I'm gonna skip over whatever. So something happened with the patient that's gonna require um, a procedure dealing with your catheterization, right? So it says the patient underwent a left renal angiogram. This required insertion of a catheter into the right femoral artery. I'm sorry, I don't have my glasses on. All right, so this required insertion of a catheter into the right femoral artery. The catheter was advanced to the right external iliac and common iliac arteries and aorta into the left renal artery. Contrast media was injected for visualization of the left renal artery upon X-ray. All right. Now, so the code would be for this 36251. Okay? And so the right femoral, the right external iliac, and the right common iliac arteries, we would say they underwent non-selective catheterization because those were the ones that they navigated to access the left renal artery. So the left renal artery is where our code would lie. All right? Does that make sense? So it will read something like that. And so all the three that it went through to get to that left renal artery would be non-selective, so we don't code it. But the renal artery where they were going to perform the procedure is where what we will be looking for when we're getting ready to assign a code. That would be selective versus the other is non-selective. So it will read something like that. Okay? Of course, you're going to need to study it. All right? And listen to this again. All right? It might take a couple of times. Again, arteries are and veins, very complicated. Just so many of them. But just go through. You can find some examples in your workbook. Work those out. If you got more questions, of course, you can email me or your instructor or what have you. Okay, just check those out. And so they use those to get those things in. So when you go in and they're trying to give you some medication through your vessels, they deal in this type. You deal in this type of coding. Okay. All right. So that's um, your selective, your catheterizations and your devices that they use. And again, you can look those over. Even in your coding manual, it has notations that you can read over. Yeah, I'm not gonna tell you a story with the vascular injection procedures that use your selective and non-selective. Again, Appendix L will be your friend. Just go back and listen to what I'm saying, and it'll make more sense. This is the first time you're hearing it, so don't overact. It's okay. Just practice and read it. Read your text and listen to it again. Yes. Okay. All right. So that is all I'm going to talk about in terms of cardiovascular. So we're going to look at what we got in terms of our week 4 cases. And we're going to get out of here so you can relax. Okay? Let's see what I got. So 3 cases for this week. And these cases is going, we got, I can tell you right off that all 3 require just one code. Okay? And with the first case and the third case, I'm gonna say the first case and the third case, they are actually coming from your patho and lab section of your CPT, and you probably wonder, okay, we did a lot with cardiovascular and stuff like that. Your patho and laboratory are a section in which you may see being used because when a person comes in pretty much whatever system, if they refer them to get lab work done or something like that, or they take what am I trying to say? Not a sample is not what I want to use. A specimen or something like that, and to run it through pathology for a specimen. So even though we in cardiovascular respiratory this week, if they order a test or a lab or something like that, then you would use codes from this section. So your patho laboratory codes begin with 8, right? case 1 and case 3. Both require code from patho and laboratory again. So you got pathology type tests and all kind of tests. So that should already kind of, this week probably your cases will be a lot easier, I can say. Then your second case, the middle case, radiology code. All right, so that begins with 7. These are straightforward. So all of them require just one code. You got your case 1 and case 3 coming from patho and lab, and then your case 2 is coming from radiology. Again, these are the type of tests and diagnostic things that they may order, even if you're coming in for something that's from cardiovascular or respiratory or so forth. These chapters I think are going to be covered in week 7, but that's pretty much it. They're going to be simple. I think that you all are going to run through those pretty quick for this week. Any questions about that? That's pretty much all the tips I need to give for the cases. They're straightforward, I believe. You'll be able to crack them very quickly. Any questions on anything we've talked about? All right. Sounds like a plan. You all study, study, study. Enjoy your week, and we will meet here. Yeah, case 3. So, you know, I talked about patho and lab. So that's what you're gonna code for. What you're gonna code for the lab? What did they do? What type of lab did they do? Think about it in that way. So in patho lab section, that's what you actually coding. You're welcome. Y'all have a good night. No problem. I enjoy them. Good night. Yes, I gotta get on that. Thank you. I can't see. Night night.